Rich, in other news tonight, Riley Hospital for Children seeing a surge in coronavirus infections. It coincides with the surge of the Delta variant. News 8's David Williams joins us now live at Riley Hospital with more on this story. David.
Riley's medical director of infectious diseases says over 80 to 90% of infections in Indiana are caused by the Delta variant, and kids are not immune. Those under 12 are not yet eligible for the vaccine. And Dr. John Christensen says they are seeing more children in their emergency room here at Riley.
In the last few days, the number of cases that have shown up in our emergency room has picked up significantly compared to in January, for example.
Dr. John Christensen says the good news is that the majority don't get admitted to the hospital, but just get seen in the ER and get sent home.
The majority of are unvaccinated children under 12 years of age, okay? Although we see the occasional older child that still hasn't been vaccinated, but the majority of them are younger ones, so still in that group that have not been vaccinated.
Yeah, that's scary.
A mother of two young children, Alyssa Hay, is well aware of the Delta variant of the coronavirus.
I'm concerned. Yeah, we kind of keep to ourselves or just come to the playground and we know the kids that are here.
She and her husband are vaccinated and they do all they can to keep their kids safe.
My daughter wears a mask whenever we go to indoor places. She's pretty good about it.
But not every kid is good about it. Dr. Christensen talked about the reasons behind the increase in cases in kids.
It's multifactorial. One, you have, in children, an unvaccinated community. Even those over 12, the majority of them are still not vaccinated. But under 12, they're completely unvaccinated. So they depend on being protected by the people that surround them by using masks and maintaining social distancing. And we know that a lot of people have relaxed that. They're not using masks. They're socializing more. They're going to large gatherings.
Dr. Christensen says there are things parents can do right now to protect your children if they are not old enough to get a COVID-19 vaccine.
We know that there are some things that do work to prevent infection. Mask use, okay? Keeping social distancing, avoiding large crowds, especially large crowds of people you don't know who they are. Obviously, their parents and other family members being vaccinated will prevent bringing the virus home and infecting the children.
Now, Dr. Christensen urges you, if your child is 12 or older, to get them vaccinated. He says anybody who can get the vaccine should be vaccinated. For now, we're live in downtown Indianapolis. I'm David Williams, Wish TV, wishtv.com, and follow us on Facebook.